My name is Eva Goldfarb. I'm a professor of public health at Montclair State University, and I've spent my career studying sex education and sexual health. One of the most powerful and effective tools we have in public health is comprehensive sex education that's taught in schools. And there's decades of research that have demonstrated the effectiveness of sex education at preventing unintended pregnancies and sexually transmitted infections, or STIs. And that's great. That research is really important because it informs us on program development, policy development, et cetera. What we have known much less about until now are the other impacts that high quality sex education has. And along with my colleague, Dr. Lisa Lieberman, we conducted a comprehensive, what's called a systematic literature review of the past 30 years of peer-reviewed research on the outcomes of sex education. And what we found is that sex education that is started early as kindergarten, that is sequential, age-appropriate, and delivered sometimes throughout the curriculum and throughout grades in a planned way, reduces child sex abuse, reduces intimate partner violence, reduces sexual harassment and bullying, including homophobic bullying and harassment, improves communication skills with peers, parents, medical providers, and partners. But it also develops important life skills that will help in many, many areas of a young person's life. It improves things like compassion, empathy, agency, the sense that I have control over my own body, decision-making skills, the ability to enter into and maintain healthy relationships. And on top of that, it also improves media literacy. And in today's age, when so much information about sex and sexuality is available on the internet, being able to discriminate between science-based, evidence-based, accurate websites and those that are misleading is really important. So what we found is that it also helps young people to feel safer, to stay in school longer. And this is especially true for LGBTQ young people and other marginalized young people, but that all young people feel safer and have greater sexual health. Small but vocal opposition to sex education portrays sex education as controversial, but that is not what the research tells us. There are decades of studies, of polls at the local, state, and national level that show that the overwhelming majority of adults and voters, by the way, support comprehensive sex education in middle and high school that includes topics such as pregnancy prevention, safer sex, STI prevention, birth control, including abstinence, but also sexual orientation, consent, and healthy relationships. And this support goes across the political spectrum, is equally strong among Republicans and Democrats, and across geographic location, regardless of a state's political leanings or policies around sex education. So it's actually not a controversial topic if you look at the research. Comprehensive sex education is evidence-informed, science-based, medically accurate, age and developmentally appropriate and culturally appropriate formal education that begins early and that builds sequentially throughout a young person's life, it takes a much more holistic view of sexual health, and a much broader view than merely the absence of unintended pregnancy and disease. It really goes into the knowledge and skills that young people can develop to help them have healthier, safe, enjoyable, respectful relationships throughout their lifetime. And what the research tells us is that just like every other education area, sex education is most effective when it's started early with foundational concepts that set the stage for more challenging, difficult concepts and discussions in middle and high school. So just as no one would ever suggest that we introduce math for the first time with 8th grade algebra, the same is true for sex education. So the kinds of things that are taught in early years of elementary school are things like body integrity. Every person, every child gets to decide what they do with their own body and who gets to hug them. And if I tell you I don't want to hug you, then you have to respect that. That sets the stage for later conversations about sexual consent. The research is very clear that in states that do not support high quality sex education, and those that use an abstinence only approach have worse sexual health outcomes than those states that do. States that teach about contraception and safer sex and STI prevention have lower rates of pregnancies and STIs. And states and regions that take an abstinence only approach have higher rates of pregnancies. The research is very clear on that. The big story, as far as I'm concerned, is not that sex education is too invasive or inappropriate for young people, or that it's too advanced for young people. It's that, in truth, most sex education is not up to par either in its quality or its comprehensiveness or the amount of time that's spent on it. So just about every state has some sort of guidance or mandates around and policies around sex education, what can be taught, what should be taught, and some have curricula or suggestions. But for the most part, those kinds of decisions about what is actually taught are left to local school districts and communities. And so what kind of sex education a young person receives can very often depend on where they live. And not only where they live, but what school they go to. So 2 different schools in the same school district may treat the topic very, very differently. So it's really, because there's no national mandate or guidance, it's really a patchwork of policies and programs. And as a result, it can be highly influenced by a few very loud voices at the local level. Who makes the most noise can have an impact on what gets taught rather than the science and the research. So that's a broad 30,000-foot view of sex education in the United States. There are national sex education standards that are available for school districts. But again, there's no federal policy or mandate on teaching sex education. What we also know from the research is that sex education, when it is limited in scope to abstinence only, to heterosexual students, and and excluding all other topics, not only is not effective, but it also can really cause harm to young people. Someone once said that a curriculum should be a balance of mirrors and windows, and everyone should be able to see themselves reflected in a curriculum and be able to see other people that they may not know and learn about them. And to the extent that we exclude certain topics, we are enforcing that certain things are taboo. We're also not only keeping young people from having life-saving information, but we're stigmatizing and harming young people who are already marginalized. That's leading to a lot of harm.